home of Tennessee's best newscast. This is News Channel 11 at 11.
Well, right now, the federal government's doubling down on its attempt to block a Tri-Cities hospital merger deal. Good evening, I'm Josh Smith.
And I'm Sarah Diamond. Staff with the Federal Trade Commission came to the Tri-Cities tonight to try to convince the state of Tennessee not to approve the merger of Mountain States Health Alliance and Wellmont Health System.
Now, the Tennessee Department of Health hosted what was likely the final public hearing before deciding whether to approve the merger. Wellmont was really the first hospital system to publicly get things started back in 2014, saying it needed to merge with another company. Then on April 2nd, the following year, Wellmont and Mountain States, former rivals, announced their plans to merge.
The first paperwork was filed to begin the approval process in September. In February of 2016, they filed the applications for a Certificate of Public Advantage, or COPA. Basically, it's a key document needed to complete that merger.
The COPA application in Virginia was deemed complete in August of that year. It was then deemed complete by the state of Tennessee in September. But then in October that year, the Federal Trade Commission openly opposed the merger for the first time.
At the request of the hospital systems, Tennessee deemed the COPA application incomplete earlier this year. This was so Mountain States and Wellmont could give the state some more information about the merger. It was deemed complete once more this past March. And tonight, the applications in Virginia and Tennessee still have not been approved, only deemed complete.
As part of the approval process, the Tennessee Department of Health held another public meeting tonight to give people a chance to speak up about the deal.
News Channel 11's Justin Soto attended tonight's meeting where the FTC said it still could not support the merger.
Yeah, Josh and Sarah, for months, the Federal Trade Commission has opposed this proposed healthcare merger over multiple concerns, including a lack of competition. And tonight, Tennessee health leaders heard from the FTC and the public 2 months before they have to make a decision.
It's a big decision.
So Tennessee held its 6th public hearing Tuesday night on the proposed healthcare merger. And like in previous hearings, vocal supporters showed up.
New health systems will be able to help our region live well by investing in programs that will decrease premature mortality.
As the Commissioner of Health listened, several said a combined healthcare company would improve the overall health of the region, but a few others,
I'm in opposition of this merger. I agree with the FTC.
A stance repeated in person Tuesday night. The Federal Trade Commission once again sent a staff member to oppose the deal, specifically criticizing the latest evidence submitted by the health companies in favor of the deal.
The additional information submitted in the consultant's report have a lot of high-level statements about goals and objectives, but don't really have details on how any of it really is going to be accomplished, how much it's going to cost to achieve.
The comments were rich, deep, I thought very heartfelt.
Tennessee's Commissioner of Health, Dr. John Dreisner, says this is unprecedented, and after months of consideration, he and his team are still deciding what's best for our region.
As the approving authority, I continue to review the application, continue to take public input, and have not yet made a decision.
The hospital systems remain confident Tennessee and Virginia law will shield them from federal opposition by ensuring oversight, protecting the public against a monopoly.
But we believe that the state action immunity laws will ultimately allow this to happen.
Armed with more public comment, Commissioner Dreisner now has 2 months to make his decision.
September 19th is the deadline for a decision, and we will certainly make it by then, if not before.
Justin Soto, News Channel 11, in your corner.
The deadline for the state of Virginia to rule on the merger application just a few days earlier, it's September 15th, and Tennessee, as the commissioner mentioned, it's the 19th of September.